Well, good afternoon, everyone. Thanks for joining us live this afternoon with the National Kidney Foundation. I'm Saskia Thomson. I'm the Executive Director for NKF serving Greater New York and Connecticut. And we are celebrating March as Kidney Awareness Month. So it's been all kidneys all the time this month. And this afternoon, we're going to be hearing from Joe Boyce and his donor, Liz Haines. So we'll give people a few minutes to join us. And in the meantime, I want to share with you what an amazing awareness month it's been. We have done transplant workshops. We've done one in Spanish. We put together 400 care packages for dialysis patients this month, thanks to some volunteers. And we've done some professional education. And of course, we've been celebrating with our fundraising galas. So this afternoon, we're going to hear a heartwarming story about two people's journey with kidney transplantation. And you'll have the chance to put your questions in the chat. And just know that at the end of this program, we'll either respond to you back through the chat or we'll follow up with you. But of course, you can always get in touch with us through kidney.org. So please join me in welcoming Joe Boyce today. So Joe received a kidney transplant in 2022, correct. If I'm correct, right? Mm-hmm. So Joe, thanks for spending time with us this afternoon. And I would love to hear a little bit about your journey.
Okay, well, it started, I'd say, 10 years ago when I got diagnosed with kidney disease. And it got progressively worse over time. And I got to the point in January of 22 where I was stage 5. And that's when my doctor said it's not when or if, it's a matter of when you're going to need a transplant. So I had already got on the New York transplant list, but that's a long wait. And then when my numbers got close to dialysis numbers range, I decided to do something about it, and I spoke with my family, and we decided to start a website to try to get a living donor.
Wow. So let me, before you get to that, because that sounds really interesting. Did you have symptoms? Like, did you know that you were starting? Were you not feeling well? We often say kidney disease doesn't have too many symptoms. So what was that like for you?
It wasn't, you wouldn't know on appearance. A lot of people now tell me that, yeah, you looked a little gray.
Okay.
I thought it was just my hair, but it was my face, my complexion. So it was, I was just always tired. I can remember a couple of months before surgery, dropping my daughter off at practice and saying, I'm going to, go home quick and then I'll come back. And I went home and I ended up sleeping for the rest of the day.
Wow.
So just very, very exhausted all the time.
Yeah. And so your primary care doctor identified this for you? Like what was that? So you go to the doctor, you're not feeling well?
Yeah, so based on blood tests, my numbers indicated that I had something wrong with my kidneys. So they recommended a nephrologist, and I had been seeing a nephrologist for about, I'd say, 3 years prior to ending up in stage 5.
Wow. Okay. Yeah, so there's a blood test and a urine test, which are typically part of a primary care exam. So I'm so glad that you went to the doctor. Now, were you on dialysis for any time?
No.
Okay,
no.
You're very lucky.
Yeah, that was one of the reasons why I wanted to try to get a living donor, is to avoid dialysis, just for sake of, living day to day and working at the same time.
Okay. So your sister, did you say your sister built a website? What was that like?
So it was a, when I went to see the nephrologist, the question I got asked all the time was, do you have a living donor? And I checked my phone and I didn't have a living donor. So
that wasn't in the emergency context.
No, it wasn't there. I couldn't find it.
This was an emergency, Joe.
It was. So the first thing I did is I spoke to my wife and I said, we have to do something about it. So my sister got involved and she said, I can start a website. And she, we gave her some pictures and she wrote up, and we went back and forth editing the narrative. And, It went live March 1st, 2022.
Wow. So the start of Kidney Awareness Month. Well done.
That's right. I
Right.
didn't realize that.
Okay.
That's right.
Okay. So the website goes up, and then what happens?
So the website goes up, and my initial reaction was, all right, something that's private is now public. And it's a little overwhelming and a little, I remember telling my wife, I just want to hide or, go somewhere and no one sees me. So she said, listen, you need someone to be the forefront and not you. And I'll be that person to spread the news and awareness about it. And, you just stay in the background. So that's the way we approach the whole website and getting the news out.
And I think we've heard that a lot, that first of all, when your doctor says, do you have a living donor, and you check your phone and you don't, you sort of feel that pressure, like, how can I possibly ask for this gift, right? This gift of life. And
Right.
so I think what you've experienced is what we've heard from other people, that that first of all, sharing that information about yourself as you're processing, it's difficult. But I think you landed on the right way, is, you're sharing your story, and you're not necessarily asking directly, but you're sharing your story. And your story has a very happy outcome.
Yes.
So tell us about how you came to find your living donor, who I bet is in your phone right now.
She is. Yes. So it went live March 1st, and I was getting updates from the transplant center saying we've got a lot of activity and a lot of people were coming forward to get tested. Obviously, they couldn't let me know who, but they said we had a lot of traffic. So there was an article in Newsday which helped a lot, but that was later on in the month. So within the first week, my wife had told me a lot of people were calling and trying to get a number to call a transplant center. So that went a couple of weeks, and then I'd say in May, transplant center would call me periodically and say, all right, we have 2 people. So I'd say, okay, I wonder who these 2 people are.
Yeah.
I don't know. I wonder who they are. So one person, we found out it was a coworker of my wife's, and I spoke to him, and he said, I'm on deck.
Oh my, I have like chills. That's beautiful.
So I said, his name was George, and I said, George, that's unbelievable. I can't believe you're willing to do this. So he said, well, there's someone better apparently. So, but I'm on deck. I'm there for you.
Wow.
So I remember eventually finding out, but prior to that, one of my donors, one best friends, I was talking to her at the soccer field, and I said, I don't know who this other person is. I wonder who this other person is. I think she knew at the time who the other person was. So
for those of you who can't see, she's sitting in the wings there.
Yes.
That's coming next.
It got to, I'd say, May, and my donor Liz had contacted my wife Christine and texted her and said if her and her husband could stop by to talk about my situation.
Wow. Okay, so you knew Liz.
We did. Yes, we did. We had rented their ski house a couple of years prior.
And I can see you did not damage it, because
we
she
didn't.
was willing to give you a life-saving organ.
Yes, that's true.
That's amazing.
Yeah.
Okay, so we're going to ask Liz some of those questions too. But now, so it's been a couple of years, right? You're transplanted. How are you feeling?
Much better. It's my health is great. I don't have to worry about certain things, but I do have to watch my diet. But it's night and day. I remember prior to the surgery, one of my friends from college had told me that you just wait until you get it, because she was a transplant recipient as well. And I said, well, what do you feel? And she said the feeling she remembers is when she woke up from surgery, it was like the sun coming out for the first time. My gosh. So it is. It's amazing. Your whole body changes.
Wow. So I have a couple of questions there. So, well, That's wonderful, and I'm so glad that you got your transplant, and that you're feeling good. So your story was in Newsday a couple of years ago, but we met for the first time a
Yes.
couple of maybe
Weeks.
three or
Right.
4 weeks ago in Washington, D.C. Joe joined the National Kidney Foundation for our National Patient Summit, where people from all over the country with an interest or stake in kidney disease meet with our representatives, members of Congress, to tell them why this is important and why they should support kidney health. So among things that we asked for support were guidelines for earlier testing, universal support for the Living Donor Support Act, which is supported in New York State and Connecticut, but other states need to sign on, and that protects living donors. So you donate an organ, you can't be denied life insurance because you're actually one of the healthiest people around. We also asked for some support to make home dialysis more accessible because it's a better quality of life. So Joe and we walked through the halls of Congress, which was an interesting and amazing experience. And I would love to hear your perspective. Like, what did that feel like for you on the other side of your transplant?
Well, once I got into the advocacy group with the National Kidney Foundation, I heard about the summit. So I was right away, I said, yes, I would love to do it, but I didn't know what I was in for. So it was a day of training about how to speak to Congress or their aides in front of you, and what are the 4 main points you want to go through. And then just walking through Congress and meeting people within their office. And luckily, it was nice to hear that all of the people were saying we're on board with this. We want to get it passed. So they were very receptive to it. But it was a great 2 days. It really was.
Yeah. Yeah. That's wonderful. I mean, it really is so important. I mean, they represent us, and, kidney health is universal, and
Right.
It really was a wonderful experience feeling that support. And I was really impressed, how well read they were on
Yes.
what we were asking about, and that they took it seriously. Last year, Kevin Longino, our CEO, was actually in the Oval Office because Congress did pass modifications to the organ procurement system to make more organs available for transplantation, in case you don't always have a living donor. So that was great. So we're going to switch over to Liz, but before we do that, I wanted to ask you, is there anything you want to share or say to Liz or share to the community about, if someone is facing this need for a transplant, like, are there words of wisdom you can share?
Well, what I've found that people have learned is a lot of people have reached out to me that need a kidney donor. And my conversations with them were, I said, well, the way I did it was through a website and getting the news out there. Well, and a lot of people are very hesitant to do that.
Mm-hmm.
So I just tell them, do you want to live? You have to do it. And there's people out there that can do it. As far as Liz, me and my wife always struggle about, because we can't repay someone for what she did. So we're constantly, any opportunity we get to thank her or send her gifts or her flowers at any occasion, we will. Even though her husband texts me and tells me to stop doing this.
Yeah,
but
well,
I told him it'll never stop. But it's something I can't repay, but I feel like I do have an obligation, and that's why I went down to DC, to try to get more awareness. And I realize I'm so fortunate. Hearing the stories down in DC from the other patients and the recipients, a lot of them were on dialysis. A lot of them waited multiple years. And I'm sitting there, and the website went live March 1st, and the surgery was June 6th. Yeah. So my story is not the norm story. And I realized that, and I realized how fortunate I was. So I feel like I have an obligation to Liz to try to get more awareness out there and to try to pay it forward.
Yeah, and I think we talked about that. That's exactly what you're doing. You're paying it forward, and it's so important. So thank you for that. Thank you for
Sure.
sharing your story today and your afternoon with us. We're going to switch things over to Liz. So while we do that, I wanted to take the opportunity to share. We have heard that exposing yourself, I guess, or sharing your story is the hardest part. National Kidney Foundation does do transplantation workshops. One module is called First Steps to Transplant, right? You find out I need a transplant. How does the system work? How do I get on a list? It's very overwhelming. And then the second module is Finding a Living Donor, which really talks about what Joe experienced. Social media, as much of a curse as it is in our teenagers' lives, is a gift when you need to share your story and really reach beyond your network. When you share your story on social media or a website or other electronic platforms, you really are just amplifying that message. And we are very happy to help you do that. If that's helpful to you, we have workshops on how to write your story, how to share your story. I know it feels like a big ask of people, but I think we're going to hear from Liz now that giving the gift of life it's not something you're just taking, it's something they're truly giving, and it's life-changing for both parties. So now I'm with Liz. Hello. Thank you so much for being with us today. So we heard Joe's side of the story. Tell us about how you came upon the website and how you ended up bringing yourself forward for testing.
Well, I'm friendly with his wife, Christine. So I had a little background that, Joe was suffering from kidney disease. I wasn't very familiar with all of the details. And then on the day that they launched the website, she had reached out to her community friends and shared the website and asked if we would then push it out through our social media as well. So I came upon the website and there was a video. So my husband and I watched it together. And we both sort of thought to ourselves and to each other that this is something that both of us would be interested in getting tested for.
Wow. So it's interesting because I just learned here that you have 4 children. That's amazing. So what did you learn just about your body and like what kidneys do? And like you've had 4 children. Were you thinking about your own health in this situation? What did you learn as part of that testing?
Yeah, so initially it started off with a blood test, and then as it became more apparent that I could be considered as a living donor, there were many meetings with lots of people through Northwell, from the nephrologist to social workers, psychologists, and they really broke it down for the possibility of being a living donor and how it would be possible for my body to compensate and almost not regenerate, but for that kidney to be able to handle my body's function for, the future. I definitely considered it in terms of my own health and had conversations with the doctors at Northwell just to be sure that I wasn't putting myself at any risk and not being able to be there for my own children.
Yeah. Yeah, that's a big consideration. But it sort of goes back to what we were talking to Congress about, the Living Donor Protection Act. Only the healthiest people are cleared to give a kidney. So kudos to you for being so healthy.
I was very happy at the end of all of the checks and
I was
balances.
going to say, you must feel very good
health.
about yourself. Wonderful. And so, we heard a little bit from Joe how his life has changed. How has your life changed since the transplantation surgery?
It really was amazing to see all the support that came from all the community members, from my friends at work and family members. And one of the big reasons that I did it was because I was familiar with Joe's children, and also having children of my own, I wanted to be able to be a role model for them, that there are things that you can do for other people, to help others, whether it be in big or small ways.
That's amazing. Really well said. I'm sure your children are so amazed by your generosity and your strength. And so what would you tell to people out there thinking about becoming a living donor?
I think that it was a tremendous opportunity to become connected with somebody else and to really be able to help someone. I think that there are so many people suffering from all different kinds of illnesses and diseases, and there's so little you can do oftentimes, but this is a way that you really can make an impactful improvement or help somebody in a lifelong way, in which other ways you just really can't sometimes. So I think also the process was really seamless. The way that we had so much support from Northwell well before, during the hospital stay and visit. And while it is a surgery and, there was pain and discomfort involved, the pain was temporary, but the benefits are really lifelong.
Yeah. So how long did it take for you to get sort of back to yourself?
And within a week, I felt a tremendous difference. I wasn't back to myself, but with each week, it was really a milestone where I was able to be more back to my own routine and engage with my children and whatnot. So by the time 4th of July, I was away on a vacation.
Which you totally deserved.
Yeah, thank you. That was only a month, outside of removed from the surgery. So it was nice, modified, but it was
that's okay. That way people can cater to you.
Yes, I didn't carry.
You should have faked that a little bit longer. So next time. Mm-hmm. All right. So are there any last thoughts that you'd like to share with anyone about this experience that you've had?
I think that it was a great opportunity, and with education and learning from the professionals, it's really something that other people might consider. It might seem like an overwhelming and daunting idea. It's not something I ever considered. But then when I learned more about it, it was comforting and I felt more confident in doing it.
Wow, I'm so glad to hear you say that. We do some workshops also around becoming a living donor. And we usually bring in people, a donor and a recipient, just because I think it really helps to bring that conversation down to what's it really like day to day. It sounds scary, but as you said, it's pretty seamless once you start in the process, and you do have a lot of support. So I think we'll end the conversation there. But before we sign off, I want to say that, the National Kidney Foundation is here for every step of the kidney journey. We have a CARES hotline. We have a peer support network. We do have workshops on transplantation. So really, whatever it is you need, we know that this is not an easy journey, but we're here for you. And we wish you a very happy Kidney Awareness Month. And thanks, it's Kidney Awareness Month every month for us. So come back soon.